within the Mediterranean and the Black Sea countries. This initiative was launched by MediPIET in a joint workshop with Medilab Secure last September 18th, with the aim of reinforcing preparedness and response of Medilab and MediPIET network countries through sharing experiences, challenges, and best practices. We are honored this time to count on Dr. Lusine Paronyan from the National Center for Disease Control and Prevention, the Ministry of Health of Armenia. Welcome. I'm Professor Nisar Bouafif, General Director of the Observatory of New and Emerging Diseases in Tunis. Welcome both, and thank you very much for participating in this webinar. We know it's a very, very difficult time. Now I give the floor to Angeliki, Scientific Coordinator of MediPIET, to introduce the speaker and to start this new webinar series. Thank you, Angeliki. You have the floor.
Thank you, Isabel. Dr. Lusine Paronyan, the head of Vector-Borne Parasitic Diseases Epidemiology Department at the National Center for Disease Control and Prevention in the Ministry of Health in the Republic of Armenia, will start the first of the two presentations that we have today. Lusine, the floor now. You are a presenter. You can share your PowerPoint presentation. We just want to remind you you have 15 minutes, and then we will continue on with the next presentation. So the floor is yours. Thank you and welcome, Lusine. You can share your screen. On the top, share content. Have a PowerPoint. Great.
Thank you, Angeliki. I hope you all hear me well. Good afternoon, dear colleagues. Hope all of you are doing well in these very difficult days. I wish to meet you in person in better times without any pandemic and in a better situation for my country. I wish you had never had to live through all the hell my nation has gone through now when fighting for existence and against terrorists. But my participation in this webinar also is our response to challenges.
Sorry, Lusine, we cannot hear you.
I guess her connection might be not that good. Lusine, can you hear us? This is our life now with the COVID. We have to depend on the technology. Lusine, can you hear us? Okay, we will try to contact her in another way. We apologize for this technical problem. Unfortunately, we see that Lusine couldn't continue with her connection. Lusine, if you can join us again, please let us know. There seems to be a connection problem. Is Nisaf with us? Lusine is here. She is. Nisaf, Lusine, you can unmute yourself. You are muted. Please unmute yourself so we can hear you.
I'm very sorry. It is the electricity problem.
Oh no. Can you reconnect again? I will make you a presenter again. Can you share your video? Great.
Lusine, if you have problems with the connection, it's maybe better you to switch off your video and just keep the sharing your screen and the audio.
Okay.
Great. We can see your video now, Lusine.
And how can I my video? No.
If you want to disable your camera, there is an option on the bottom of the WebEx session.
No.
It says stop video.
I can't find it. I can't find it.
Okay, but you can continue on, and hopefully there is not going to be an issue.
So it is very important for us also to have this opportunity to share experiences. Just a few words about my country. Armenia is located in the South Caucasus, bordered by Georgia in the north, Azerbaijan to the east, Turkey to the west, and Islamic Republic of Iran to the south. The climate is highly continental, with hot summers and cold winters. The population of about 3 million, with administrative division of 10 regions and capital city Yerevan. Now about the epidemic situation of coronavirus disease in Armenia. The first COVID-19 case was registered on the 1st of March. Total cases up to now more than 58,000. Incidence rate is 1922 per 100,000 population. Deaths from COVID-19 is 1,032. Fatality rate is 1.8%. Total number of tests done are quite high, more than 330,000. And here we can see weekly confirmed cases and deaths. As you see, after a small period of decrease in the end of July and in the August, now again we have quite high number of new cases every day. And yesterday's result is 1,058 from 2,877 tested, which is awful. We never had this daily number during the whole period of pandemic. Here we have incidence rate per 100,000 population by regions. As we see, the incidence is the highest in the capital city, Yerevan, also in Shirak, Lori regions, where we have big cities. Sex distribution is, as you see, among cases, about 62% are female, and among dead cases, more than 53% are male. According to the age structure analysis, the highest incidence of the disease was reported in the 55, 64, and 30-39 age groups. Among children, the highest incidence of the disease was observed in 15-20 and the 0-5 age groups. Deaths were mostly reported in the over 55 age group. Now about anti-epidemic measures. Having a number of geopolitical features, Armenia has developed and implemented its own national strategy to respond to COVID. The basis for the national strategy was WHO Critical Preparedness, Readiness and Response Actions for COVID-19. Have been developed continuous strategic plans for each stage of epidemic development. Has been a created national COVID-19 task force, which has set up under the leadership of the commandant, who is the deputy of Prime Minister. The national COVID-19 response was organized and carried out on the team basis with the involvement of all stakeholders. A state of emergency was declared in the country, which was extended until September 11. Gradually have been lifted restrictions in industries and institutions. In parallel, strict requirements and rules for ensuring an anti-epidemic regime were implemented. Thus, the state of emergency operated 6 months, quarantine 4 months. Now, after the cancellation of the special regime, the new revision of the law of sanitary epidemic safety was adopted, and the government decision on quarantine measures with the regulations of the Ministry of Health on prevention of coronavirus infection in different institutions and organizations. Restrictions during social events, funerals, etc. are adopted. But I have to say that after this military escalation, these measures are went to the second plan, and as a result, we face the increase of the incidence now. Now about the detection of cases of COVID-19, equal access to medical care was provided in the country, including laboratory diagnostic and treatment. Treatment was carried out within the framework of state order. This means free of charge for the patients. 19 specific hospitals have been designed and 2 triage centers. Until June 1st, all were tested according to WHO case definition, including body temperature starting at 37 degrees. And up to the 1st of June, all positive cases were hospitalized, those without symptoms placed in hotels with medical services. All from quarantine at the end of 14 days were released by 2 negative results. From June 1st, they stopped testing without symptoms after 14 days of contacts and self-isolated. Testing of all suspect cases continues. The diagnosis of COVID-19 is made only if there is a positive PCR test. Now, asymptomatic and mild cases are treated at home with regular outpatients and polyclinic services. During this period, the Ministry of Health is leading national response to COVID pandemic, and the National Center for Disease Control and Prevention is responsible for surveillance, coordination, communications, and international reporting. A few words about my institution. The main activities and objectives of the organization in the field of public health are implementation of measures of prevention and of infectious and non-infectious diseases, provision of preparedness and response to public health threats, implementation of scientific and medical research studies, health promotion and awareness, etc. And this picture picked up from our website, where all the detailed daily information is situated with public advice on prevention of COVID-19. NCDC implements its activities by its 11 branches in regions and in Yerevan, and reference laboratory center. Total number of staff of the organization is about 1,000 people. Our reference laboratory center was renovated by US DITRA. We can say it is the most isolated laboratory in Armenia, designed for biological agents of risk group 1st and 2nd. In our reference laboratory, we have 10 specialized laboratories, among them the Laboratory of Virology, which was the first to start the COVID PCR testing in the beginning of February. Now 10 laboratories, public and private, are assigned to diagnose coronavirus disease, including in our branches in Shirak, Lori, Davush, Sunit, and Gevarnik branches. For the real-time surveillance, our Med electronic health system was adopted, which gives current data with the dashboard on all cases, hospitalization, isolation, etc. For example, for now we have 10,717 active cases. From them, over 1,600 are hospitalized. More than 15,000 contacts are self-isolated, and isolated contacts from the beginning of the cases in Armenia until now is about 182,000. Measures for contact detection. We do epidemiological investigation of each case, also identification of contacts in families, organizations, and institutions. Contact persons were subject to isolation for 14 days before June 1st and tested. After June 1st, contact persons are placed on self-isolation at the place of residence. Based on WHO guidelines, methodological for contact tracing was adopted with the definition of the contact person, the information framework needed for clarification and questionnaire to interview each patient, how to ask to clear up all the contacts and identify the risk of infection. All the contacts were called and during these telephone calls and also during general awareness program and maintaining the call center in 7/24 mode, a huge amount of work has been done with the population to ensure that people are involved in maintaining their own health. As a result of these actions, it became possible to significantly reduce the spread of the infection in the country, to keep the situation under control, reducing the burden of the health system, to provide trainings for a range of specialists. All this was a great lesson for further more adequate organization and implementation of preparedness. But now, as we see, all our efforts are not effective, and we are facing health and humanitarian crisis. Sorry to finish with this disappointed note, but this is what we have for now. Thank you for your attention, and I am ready for your questions. Thank you.
Thank you so much, Lusine. Your presentation was excellent. You give us a really nice overview of what you're doing in Armenia, you are also dealing with another difficult situation right now. So it's amazing all the work that you have done. And thank you for keeping the time so well. In the interest of time, we will save any questions and comments for your presentation during the plenary session. So please stay with us. until the end of the webinar. Thank you. So thank you so much. And now we will go on with our second presenter. So Professor Nisaf Bouafif, is Nisaf connected? So Lusine, you can mute yourself and yes, and you can turn off your video just to save some technical problems. Nisaf,
if you don't mind, I think that Nisaf has some problems for connecting, so maybe we can go through some questions to Lusine while we're waiting for Nisaf to connect.
So
thank you.
That's a good idea. Thank you, Concha. Okay, so if there are any questions for Dr. Paronyan, you can raise your hand. I will give you the floor, or you can write it in the chat in case you don't want to talk. Any comments, any questions, any remarks, any similarities in your country that you want to discuss with Dr. Paronyan?
Yes, Angeliki, if I may. This is Isabel. Thank you very much, Dr. Lusine. It was an excellent presentation and really comprehensive about what is happening and has happened in your country. My question is a practical question. I mean, from your opinion, what main difference before and after COVID-19 in your countries? What will be the difference in terms of surveillance, preparedness, response, providing more staff to the surveillance system, resources, visibility, and added value from the government point of view of training epidemiologists, which is the core of this project. What is the difference before and after from your point of view?
Thank you, Isabel, for the question. It is very important for us. For my point of view, I see that people and in government also, they are started to realize what is epidemiological service, what our epidemiologists do, and how important our measures that we always try to suggest, try to force. And I'm sure that after this COVID situation, government attention to our services will be more attentively, and human forces and trainings will be more comprehensive, more and more. I hope. And also for all health system, it was a good lesson for us how to organize, how to be prepared for this kind of challenges, and to force our measures more effectively.
Thank you very much, Dr. Lusine. This is, well, a positive thing.
Yeah. Yes, that's it.
May I ask something, Lusine? Concha speaking from MediPIET.
Yes, Concha.
Yes, I would like to know how, what are the difficulties that you found to do the contact tracing in your country? The most relevant difficulties.
First of all, when we have a lot of cases, for example, today we have more than 1,000 cases, and it is very difficult to have a chance to speak to each patient, to find out all the contacts, and after this special regime cancellation, it is very difficult to gather to other stakeholders, for example, police, etc., to keep people self-isolated. Because when it was special regime situation, then police were acting very strictly. They were checking people situation, and they were checking if they not leaving their place of residence, they are really self-isolated. But now we have some difficulties, and after the cancellation of this special regime, people also treat it like everything is over, and they started to communicate each other more openly. Sometimes they don't wear masks, they don't keep this social distance, and for contact tracing we have problems with human workforce. For example, just a few minutes ago we were asked to help our Yerevan branch, Yerevan city branch, to call the positive cases that they can't deal with, because though there are 50 people all the time are on the phones and call all of them, they don't manage to catch up all the people. That's why sometimes we also invite some volunteers, especially when we had many cases. We invited volunteers to help us, and it was also was very helpful. Maybe now also we will have to do that. And also sometimes, especially in the beginning of the pandemic, people, they didn't understand the seriousness of the disease, and they were telling that there is no such kind of disease, it's all fairy tales, we will not catch the disease, etc. It was very difficult to convince them to make them understand that it's real problem, and sometimes they after contacting we had some cases, and people realize on their own body that the coronavirus is very serious threat. I think that's our challenges on contact tracing, and sometimes social issues are coming up, because people are telling that yes, we will stay at home, but who will care about our food, about our businesses, etc. We can't stay at home. Then during this special regime, social services on municipalities, they were actively involved. Now again, here we have difficulties there. Sometimes people are not satisfied with the services that they are acquiring from ambulatory system, from polyclinics, and our hotline in the Ministry of Health and in our NCDC, it calls all the time, and people are complaining. They are asking to help with the medicines, with the medical examinations, etc. That these all issues we have now, and they are coming more because the cases are more, and with refugees we have more cases in the facilities that these refugees are situated. We have the cluster of cases now. So we have a lot of difficulties with this. Sorry.
Thank you very much, Lusine, for this extensive answer. We have a question in the chat also, so I will read it. What do you think were the best courses of action did the government do to further reduce new COVID cases? Also, what were the roles of the Armenian military and police in the aid of COVID-19 cases?
I will start from the end. The military was not involved in the height of COVID-19 cases, but police was with us. Were checking the safe isolation when, especially in the until the 1st of June, when all the cases and all the contacts were isolated and quarantined. Then sometimes people try to escape these quarantines, and we had to go to the police, call police to quarantine for 14 days, to put them to the hotel for 14 days. And after that, police was involved in surveillance of self-isolated people. They were checking their place of location by a special program. It was a mobile phone program, and also they were checking if these people are not leaving their place of self-isolation. About the best courses of actions that government, I think our government did its best from starting these restrictions, and all the legislative acts were adopted, and all the stakeholders were involved. But these restrictions, they can't stand for all over the time. We had to come to our real life and start to live with COVID. And we during this awareness campaign, we tried to convince people that it's also their responsibility how to avoid to be infected, and by keeping this social distancing, wearing masks, and disinfecting their hands. I think I answered the questions. If any clarification is needed, please.
Thank you. Thank you so much, Lusine.
Thank you, Lucy. Thank you.
Yes.
Thank you, Lucy. Yes, there is a thank you. And if there are, because we do have some other connection problems with our colleagues in Tunisia. Else wants to share their experience, if they are similar to that of Armenians, or if they did something differently and it worked, then what to... Yes, Lusine, sorry. Yeah.
Yes, may I ask, it is very important to have this opportunity of sharing experiences. I want to ask in the experience of other countries to compare our situation and to see maybe we did something wrong, that now we have this huge amount of cases. How in other countries they are doing this contact tracing. It is very interesting and very important to have your experience also.
Great, yeah, thank you, Lusine. And that's the main purpose actually of this series of webinars, and not only for all the countries to present what they did, but mainly to share their experiences and the best practices or lessons learned. So yeah, so please, whoever from the participants from other countries, please share Lusine and all the others, of course, with each other. You can unmute yourself or I don't see any raising of hands. I would like to ask you something, I guess, Lusine, if I may.
There is one more question. If you don't mind, I will answer. Yes?
Yes. Oh, there is another question. I don't know if you can also see it. So how did the Armenian government handle return residents abroad?
All the residents could return home unheeded. And before the flights were closed, and after that, when they were coming until the 1st of June, they were placed to the current hotels in quarantine for 14 days. After that, also they are isolated in their place of residence or the place where they choose for self-isolation. Now they can give the PCR test, and if the result is negative, they can go out. Otherwise, they have to stay in their place until 14 days.
Or any other questions? But I would like to ask you a question, Lusine, if I may. So you explained the real-time surveillance with this electronic system, which is really amazing. But so this is so the information from the medical doctors of those who report the cases goes directly into the system, like on and then on a daily basis, and you don't, like the public health professionals, do not intervene into this data. So the data from the perfectionists and the data from Armenia feeds directly the system, and you get the results.
This system, this ARMET electronic system, when some doctor wants to have his or her patient to be tested, they are opening the window because all the people in Armenia are in this system. They are opening some reference for this patient and asking for the testing. And these testing laboratories, for example, in polyclinics in Yerevan city, there are several polyclinics that doing sampling, and they put the data of the patient in this electronic system. And all people that undergo examination, PCR testing of COVID, we can see all of them. And once the result is positive, the doctor sees that his patient is positive, and if the patient is asymptomatic or mild, the patient can stay at home, or if he has a severe case, he refers the patient to the hospital, and this to the triage center. Triage center decides where to place the patient according to complications or age and saturation, etc. And public health doctors, epidemiologists in NCDC, we can see in this system daily basis or current situation. For example, if I give in the filter today's date, I can see all the people that have tested today and all the positive cases. And in our branches, they also see all this data, and they pick their residents. For example, in Syunik region, they can take all the patients positive in Syunik region from this system, and they started to call because in this system also all the data for this patient, including addresses, telephone numbers, their doctors, primary healthcare unit, etc. It's really good and helpful, this system.
No, I can definitely understand that. So
Angeliki, you seem to be disconnected.
All the doctors, all the medical doctors do have access to this system and they report. But I wanted to ask you if there are any alternative ways in which someone cannot access the system, or if there are any health institutions or private hospital or private practices that are not using this system because of technical difficulties. We do face some kind of an issue here, like in my country, in Greece. Actually, there is a similar program, but with a lot of problems. So there are alternative ways of reporting the cases. Are there such ways in Armenia, like by another means of transferring the information?
Until now, there was no case of not having this system functioning, but also when we are calling the patients from our branches, our epidemiologists, when they call the patient, they are asking this person also to let his or her doctor know that he is positive, and that this doctor was aware about his patient and take care for 14 days. Also, when we put the contact persons in this system, primary healthcare units, they also see isolated contact persons, and after the end of the 14 days, they give relevant prescription, relevant document for why this person was absent from the work, to not this person be stay without salary. That's it. I have one more question. I see. For economic data, the Armenian government plan to reduce social distancing in public transports, because in the Philippines, the government is currently studying to increase passenger capacity in public transports to help the economy to recover. Thank you for your response. Thank you for the question. Until now, because we still have a lot of cases, these restrictions on public transports are on place, though because of this difficult situation, not all the inspectorates are on their places to check if there is sufficient number of people in transport, and also Now it is not checked, unfortunately. Maybe it is one more reason why we have this amount of cases, but I see the experience of Philippines that government already started to increase passenger capacity, but we still keep our social distance 1.5 meter. Even CDC, they suggested 1 meter. Yes, 3 feet, but still in our legislative acts, in our orders, 1.5 meter is there.
Thank you, Lusine. It's interesting because I think it goes over all the countries now with the situation like this with the public transport, and especially for economic reasons, some of the countries might not be able to increase the capacity. But it's great to hear the experience from Philippines that they are discussing that in the government. So it will definitely help the economy to recover and also to minimize the spread. Any other comments, questions, sharing of another experience like Lusine asked from other countries? Okay, people are shy, obviously. Lusine. So I don't see any comments. So I will ask the team if they have any questions from our team.
Yes, I have a question.
Yeah, sure.
How do you deal with these long response to this pandemic, and how you deal with the staff that is overload and overwhelmed and cannot afford with the daily job? So do you have mechanisms for hiring new staff or for them to refresh a bit? How do you deal with this human resources management?
It is really a challenge, but when this period of little decrease we had, some people, they managed to have their vacations, and also some people from our branches, they had COVID and stayed at home. It is also some period of not working, and now they are again in our rows. We don't have these many specialists to hire the other specialists. But as I told before, we sometimes asking some volunteers to help, though this job with contact interviewing, we try to do with epidemiological stuff. It is really challenge. We are overloaded until this how many months already? 7 months. But now we are telling that where is our COVID? We are ready to work 40 days for 7 days, 24 hours, but not with the war. We want to be peace, and we will deal with the COVID.
Thank you, Lusine, for your sincere reply.
Any questions? Any comments? Any willingness to share your experiences on surveillance and contact tracing and case investigation of this unfortunately very challenging disease as we all face it? I don't see this. Please. Okay, there is a question actually on the chat, Lusine. So is there any special change in the definition of the suspect or probable case definition since influenza season started? For Armenia, can you change the definition or no?
No, we were thinking about it. We have a separate case definition for influenza and for COVID. For influenza, we have some centers, sentinel surveillance for influenza. Anyway, all the cases with influenza symptom also go through a PCR examination for COVID. We were thinking about to change the definition, but now not yet. We didn't manage yet.
Lusine, I think it's an issue that all the countries will be facing. Any other questions? Any other comments?
Well, just to remind everyone that this was a series of webinars that aim at providing the opportunity to exchange experiences, to discuss, to share concerns about the topics proposed. So this is the main aim. The excuse is the presentation of one of the countries or two of the countries. Unfortunately, today we haven't had the opportunity to hear Tunisian colleagues, but we have a lot of people connected, and for sure there is a lot of experiences here and there. So it's open for you to participate, to share, and to not only to launch questions, but also to express yourself and share experiences in your countries. Thank you.
Thank you, Concha. Thank you for remembering the main goal of this webinars. I invite all of you to exchange experiences with Armenia that have presented an excellent report about what they have done. Regarding this exchange of experience, I would like to share with you some experiences from Spain. For example, this COVID-19 has been a difficult point to deal with this emerging disease, since it seems that we were not prepared in terms of alert response to deal with this epidemic. We had in different autonomous regions. We are the most decentralized country in the European Union, and I think that we had few people working and involved in epidemiological surveillance and response and preparedness. And this is the reason why you were asking some half hour ago, Lusine, that what was the response to the epidemic from other countries in terms of contact tracing. I think that we had to hire a lot of people, lot of doctors and different kind of public health personnel to deal with this epidemic in different regions, since at the beginning we had no enough staff to deal with the contact tracing. So in many regions we started hiring people for this activity, At the beginning, we were at home, so people with symptoms was the one with the most activities regarding contact tracing, but people without symptoms was less likely to be traced, since the testing policies by that time was very low. So we had no tests to be distributed within the population. We started with an open testing policies month later. So, well, I think we had the same challenge in different European countries. As far as I know, I had a discussion 2 days ago with Santé Publique France, and they had about the same problem with the contact tracing that was decentralized in different regions also, and they had troubles to look for people to collaborate in this activity. I think this has been a learning experience for most countries, European and non-European countries, and it should be something that we should keep in mind and highlight the importance of having a very good staff trained in epidemiology and preparedness and response. So we should take advantage of this disease, this pandemic, and the experiences in different countries to highlight the importance of having a very good and well-trained staff to deal with pandemics, future pandemics, because we will have, and to be really prepared to any challenge that can affect population health.
Thank you, Isabel. We have two questions also from the chat. One is linked to the previews on the case definition of COVID regarding during the influenza pandemic. So the person is asking if every influenza case should be tested for COVID. I assume that this is launched to Lusine.
Yes, I will answer this question. No, if it is confirmed in influenza case, it wouldn't be tested for COVID, but any patient with any symptoms will be tested for COVID also. But if it is already confirmed as influenza, it wouldn't test it. And the other question?
The other question is, do you have a specific ratio in contact tracing?
Specific ratio, I think how many contacts are coming from each case. Do I understand correctly? As we have about 58,000 cases, all of our contacts, isolated contact, etc., they are 182,000. So it comes about 3.1 for each case. Is it the answer of your question?
Thank you.
Yes, Lusine, thank you. Thank you so much. Thank you so much for addressing all the questions that were asked to you and having such a nice discussion. Yes,
I'll try my best.
No, you did, and thank you for sharing your experience in such a difficult time otherwise for you, not only for COVID. So we really appreciate your time. Thank you so much, Lusine, for your very active participation, and I would like also to thank all the participants. But before we close, I would like just to ask to stay a little bit. I'm going to give the floor to Maria Grazia Tente from our partner from MediLab Secure to inform you about the course that they are running. So Maria Grazia, the floor is yours. You can unmute yourself.
Yes, thank you. Yes, can you hear me?
Yes, we can hear you, Maria.
Okay. Only 2 minutes to remind to and inform to all of you that in order to cope with this epidemic and to try to reinforce our capacities, we have developed a specific course on COVID-19 emergency, starting from the course that was developed in Italy, that, as you know, was really hit a lot by this epidemic. So the course is available for all of the professionals that would ask to start it. You can ask the access through MediLab Secure or through myself. I'm going to leave in the chat the connection to the information to the course and also my email address. And please, if you want any additional information, contact us, because in the course you will see that many of the issues that were discussed today are, let's say, proposed and discussed in order to reinforce our capacities on this aspect. Thank you very much. Bye-bye.
Thank you, Maria Grazia, and we will be sure sharing your information. You can write up on the chat. And yeah, here it is. So whoever wants to see what is the course is about, the very useful course, you can take the link and address any question to Maria Grazia. Thank you for sharing your email as well, Maria Grazia. Please, I think you only sent it to me, so make sure you send it to everyone. So I'm gonna give you the link now, so everyone is aware of it. And here it is, the email of Maria Grazia, in case you want to address any questions regarding this interesting course. So on that note, I would like to thank everybody. Unfortunately, our presenter, Dr. Nisa Wafif, had to go to a press conference, and she couldn't present the Tunisian experience. So we apologize for this inconvenience, but people now heavily involved with COVID cannot predict their time schedule on an exact manner. So thank you everybody for your patience, and thank you so much for being with us and dealing also with the technical difficulties. And with these webinars, we conclude at the beginning of our fall, let's call them like that, our fall series of MediPIET at Home webinar series. And that was also started after September 23, where we have our kickoff webinar with the COVID-19 Actions Taken Review workshop in collaboration with our partners in MediLab Secure. So we would like to continue to have you with us in our next webinar, where you will be, it's going to be advertised and you're going to be informed. It's going to probably be in 3 weeks' time, but you will get all the necessary information by email and invitation. So if anyone wants to say anything, here is your chance. But otherwise, thank you so much. And please be safe until then. Thank you.